We often hear about, the physical and mental toll of health conditions,
Yeah.
but sometimes there's this extra layer, the weight of how society sees it.
Yeah.
And addiction, well, it carries a particularly heavy stigma. It can actually get in the way of people getting better.
Absolutely. It's way more than just one person's struggle. It's all tied up with these public ideas,
Hmm.
um, often seeing substance use disorders as like a moral issue instead of a chronic illness.
Which they really are, chronic illnesses.
Exactly. And that viewpoint, well, it has huge effects. Does someone feel okay asking for help? What resources go towards treatment? It impacts everything, really. Individual lives, whole communities.
Right. And that actually brings us to this really interesting thing happening in Florida, trying to tackle this directly.
Yeah.
It's called the Stories Ending Stigma campaign. It's a joint effort. You've got Live Tampa Bay, the University of South Florida, USF, and the Central Florida Behavioral Health Network involved. And their aim is to chip away at this addiction stigma across a pretty big area of the state, 6 counties, Charlotte up to Pasco. So quite a mix of people there.
It's really key that it is a collaboration, isn't it? You've got the university side, the community groups, the organizations on the ground.
Yeah.
That kind of approach, it shows they get how complex stigma is, that you need everyone pulling together.
Totally. So for our deep dive today, we're looking at the Live Tampa Bay USF final report. So an evaluation came out last May looking at how well this campaign actually worked.
Right.
Our mission really is to figure out, how effective can a social media campaign using personal stories be in reducing stigma? And we want to really dig into what this evaluation found.
Okay.
So let's unpack this a bit. What exactly is addiction stigma? What forms does it take?
Well, it works on a few different levels, and they're all connected. First, there's public stigma.
Okay.
That's the stereotypes, the discrimination you see out in society, the idea that addiction is like a moral weakness or something.
Right, that judgment.
Yeah, and that leads to people being excluded, discriminated against at work, things like that.
Yeah, feeling kind of branded, treated differently just because you're dealing with a health issue.
Precisely. Then there's self-stigma.
Self-stigma.
Yeah, that's when people start to, believe those negative public ideas themselves, apply them inwardly.
Oh, wow.
And that can really create feelings of shame, guilt, feeling worthless, makes it even harder to ask for help.
That sounds incredibly isolating.
It is. It's profoundly isolating. And finally, there's structural stigma.
Structural.
Yeah, this one's often harder to see, but just as damaging. It's about how institutions, policies, in healthcare, the legal system, jobs, housing, how they create barriers. Inequality for people with substance use disorders.
Like what kind of barriers?
Well, think about like not having easy access to good, affordable treatment, or hiring practices that screen people out if they have a history of addiction.
Right. So it's this really tangled up problem.
Mm-hmm.
Affects people personally, but it's also baked into the system around them.
Exactly.
So how does all this stigma, stop people from actually getting help?
It's a huge barrier, really, at every single stage. Just the fear, fear of being judged, discriminated against, isolated socially, that comes from the public stigma.
Yeah.
That alone can stop someone from even admitting they have a problem, let alone thinking about getting help.
Right.
And then the self-stigma just adds to it. People might feel like they don't deserve help or that they're just fundamentally flawed. And then structural stigma puts up actual roadblocks, like trouble finding treatment or maybe facing legal trouble instead of getting the care they need. It's a really vicious cycle. Keeps people stuck.
Wow. Yeah, that paints a very clear and difficult picture. The report also mentions specifically that the stigma around opioid use disorder is even worse. Why is that?
Yeah, sadly, that's true. The opioid crisis, it's been all over the news, right? Often focusing on the tragedies, the overdose deaths.
Yeah.
And unfortunately, some of that coverage, maybe without meaning to, has ended up painting people with opioid use disorder in a really negative, sometimes dehumanizing light. That kind of story just fuels public fear and judgment. Plus, the fact that opioid use is often criminalized, that pushes people further to the margins. It reinforces that wrong idea that it's a moral issue, not a treatable medical condition.
Right.
So that intense stigma just makes it even harder for people struggling with opioids to step forward and get help. Help that could literally save their life.
It's a stark reality.
Yeah.
Okay, so given all that, how did Live Tampa Bay try to fight back with this Stories Ending Stigma campaign? What was their approach?
Well, their campaign design was actually very strategic. They based it on something called the collective impact framework.
Collective impact.
Yeah, it's basically about getting different groups, nonprofits, government, businesses to work together in a structured way.
Mm.
Shared goals, measuring progress together, making sure everyone's pulling in the same direction.
Okay, that makes sense.
And they also use strategies that are, proven to work, based on research showing that contact-based approaches can reduce stigma.
Contact-based,
Yeah.
like interacting with people.
Exactly. The idea is that positive interactions with people who've actually gone through substance use disorder and recovery can be really powerful. It helps normalize treatment, normalize recovery, and encourages other people to maybe seek help themselves.
So the core idea was really, if people hear these real personal stories, maybe their attitudes start to change.
That's it exactly. The main strategy was getting these personal stories of recovery out there, using lots of different channels,
Okay.
social media, obviously Facebook, Instagram, YouTube, but also doing in-person events in the community and working with all sorts of different local organizations.
That sounds smart, meeting people where they actually are,
Yeah.
right?
Yeah.
Online, but also in their neighborhoods.
Right.
And the report mentions the reach was pretty incredible. Over 11 million social media impressions in just 8 weeks. That's huge engagement.
It really is a massive reach, especially if you compare it to similar campaigns they mentioned. Like one in Pennsylvania got about 104,000 impressions a month.
Wow.
So the Tampa Bay numbers, yeah, they blew that away. It got really wide exposure in a pretty short time.
And it wasn't just about like eyeballs on screens, was it? They built a lot of partnerships too, really diverse ones.
Oh, absolutely. They put together this impressive network, 163 community leaders, 111 community organizations.
Wow.
And it was a real mix. Healthcare folks, recovery groups, but also arts organizations like Florida Studio Theater, a solo rep. Even national players like Sam H. Essa, the Clinton Foundation, Hazelden Betty Ford. They even got some, famous people in recovery involved to help spread the word.
That kind of wide net, bringing everyone together, really shows they were trying to hit this from all angles in the community, doesn't it?
It really does. A very comprehensive approach.
And the stories themselves, what kind of themes came up in those?
They collected a lot of them, 304 recorded stories, and they focused on themes really aimed at breaking down that stigma.
Like what?
Well, things like normalizing getting treatment, showing that treatment actually works, that it helps people recover, and really hammering home the message that recovery is possible, that lots of people achieve it.
Okay.
They also worked hard to frame addiction as a medical condition, like diabetes or heart disease, not a character flaw.
Right, shifting that perception.
Exactly. And importantly, just letting people know that support is out there. You don't have to go through it alone. They even included stories from family members, loved ones.
That variety must have been really powerful, hearing from different perspectives.
Yeah, I think so.
And I saw they used geo-targeting, focusing on specific areas. What was the thinking behind that?
Yeah, that was a really clever part of it. They aimed their campaign efforts specifically at zip codes within those 6 counties that had the highest rates of overdose deaths.
Ah,
The thinking was, stigma can be even stronger, even more damaging in communities hit hardest by the opioid crisis. So they wanted to concentrate their efforts where the need was arguably greatest. It shows they really understood how local context matters.
so not just a broad blast, but really focusing resources where the crisis was most intense. Okay, makes sense. So they run this 8-week campaign in Tampa Bay.
Mm-hmm.
How did they figure out if it actually worked? How did they measure success?
Right. So the evaluation used surveys. They surveyed people in those 6 counties before the campaign started and then again after it finished.
Right.
They use a specific tool. It's called the Shatterproof Addiction Stigma Index, SASI for short. It measures different aspects of stigma, attitudes, beliefs.
Gotcha.
And the key thing they did was compare the answers from people who had seen the campaign messages with those who hadn't.
Ah, okay. So comparing the exposed versus the unexposed group.
Exactly. It's important to remember, though, they weren't tracking the same people over time. It was different groups surveyed before and after, a comparison of snapshots, basically.
Understood. A before and after picture with a control group, more or less, to see the campaign's effect. So what did they find? What were the positive results in Tampa Bay? Sounds like it did have an impact.
Yes, there were definitely some very encouraging results. One big one was about social distance.
Social distance.
Yeah, basically how willing people are to interact with someone with a substance use disorder. The group exposed to the campaign showed a significantly lower desire for social distance, both like in social situations and at work.
Well, that's really significant, isn't it? Being more willing to actually engage with someone. That says a lot about changing views.
It really does. It suggests a real drop in those discriminatory attitudes, maybe more willingness to include people.
What else did they find?
They also saw better problem recognition. So people exposed to the campaign, when they read a little story about someone struggling, they were more likely to see it as more than just, normal ups and downs.
Right.
They were more likely to recognize it could be a mental illness, a physical illness, a chronic medical disease, which is exactly what the campaign wanted, reframing addiction as health issue.
So moving away from that idea that it's just willpower or bad choices.
Precisely. And related to that, the campaign exposed group just showed lower levels of public stigma overall. They were less likely to agree with those negative stereotypes, like people being untrustworthy or incompetent.
Right.
They also showed more support for harm reduction strategies. And, importantly, less stigma around medication-assisted treatment for opioid use disorder, MOD.
Oh, that's huge,
Yeah.
given how effective MOD is, but how much stigma it still faces.
Absolutely. The exposed group, they believed more strongly that doctors should offer MOD, that it is effective treatment. They were even more willing to have a MOD clinic in their own neighborhood.
Wow.
So, yeah, a big shift in attitudes towards a really vital treatment.
That's incredibly positive. Did the campaign affect people's knowledge, too? Like practical knowledge?
Yes, it did seem to. People exposed to the campaign knew more about naloxone.
The overdose reversal drug.
Right. They knew more about where to get it, how to use it. They also said they knew more about how to find addiction treatment services in general.
Okay.
And interestingly, they also had a stronger belief that Florida, as a state, is heading in the right direction when it comes to addiction treatment.
Those are all really practical things. Knowing about naloxone, knowing where treatment is, that can save lives. That's empowerment.
Definitely.
What about people who actually identified as having a substance use disorder? Did the campaign affect how they felt about themselves?
Yeah, this was another really positive finding. Among people who said they had a substance use disorder, the ones exposed to the campaign reported lower levels of self-stigma.
Okay.
Specifically, less fear of what they called enacted stigma, basically, worrying about how other people would judge or treat them if they knew.
Oh, right.
They were less likely to think people would see them as worthless, or always be suspicious about relapse, or think they were just weak-willed.
That seems so important.
Yeah.
Lifting that burden of shame, that fear,
Yeah.
it could make it easier to seek help, right?
Exactly. It fosters hope, reduces that internal barrier.
Any other key positives from Tampa?
Yes, one more thing. The exposed group was also more willing to seek help from a minister or clergy member.
Interesting.
Yeah, suggests the campaign might have helped reduce stigma around getting support from faith leaders, too.
Okay, so overall, a lot of positive movement in the Tampa Bay area. Attitudes, knowledge, self-perception. Seems like it really moved the needle on several fronts.
It does seem that way, yes.
But the report also mentioned some counterintuitive findings, things that didn't quite fit the pattern.
Yes, and this is where it gets a bit more complicated. Despite all those positive trends, the group exposed to the campaign also showed a greater tendency to agree that the person in that little story, their problems were caused by bad behavior and a lack of moral strength.
Wait, really? That seems like the exact opposite of what the campaign was trying to do.
It does, doesn't it? It directly contradicts that core message about addiction not being a moral failing.
Huh. Were there other things like that?
Yes. They also found, on average, a higher agreement with the stereotype linking substance use to violence in the exposed group. And, maybe the most concerning, people exposed to the campaign were more likely to agree that schools should be allowed to expel students who have substance use disorders.
Wow. Okay, those are definitely unexpected and kind of worrying, running counter to the whole point. Any idea why that might have happened?
Well, the report doesn't give definitive answers, but it suggests they need to look closer at the specific messages in the stories. It's possible, that some stories, even though they were meant to build empathy, might have accidentally triggered or reinforced some negative ideas for some people.
How?
Maybe, for instance, some recovery stories that really emphasized the negative behaviors or consequences before showing the after. Maybe that contrast accidentally stuck with some viewers in the wrong way, focusing on the past negative traits rather than just the recovery journey.
Ah, I see. It really shows how tricky this is, doesn't it? Reducing stigma is delicate. Even well-intentioned messages can land differently than you expect.
Exactly. It's complex.
Okay. But they also did a national study, right? outside of Florida, what did that show? Did it have the same weird result?
Yes, they did a national online study, randomized controlled trial. They took a sample of people across the U.S. except Florida, so there was no overlap.
Right.
And they randomly had people watch either the stories ending stigma videos or some unrelated control videos. Then they surveyed them before and after.
Okay, and the findings there.
Generally more consistently positive, actually. Similar to Tampa, the national group who watched the stories showed significant drops in wanting social distance, both socially and at work, compared to the control group. And importantly, that group showed less agreement with the idea that addiction is caused by bad character.
Ah, so that counterintuitive finding from Florida didn't show up nationally.
Correct. Nationally, the stories seemed more effective at challenging that specific moral failing misconception.
Interesting.
Also saw better support for UDO, lower UDE stigma, in the stories group. And when they just looked within the group that watched the stories, comparing their own before and after answers,
Yeah.
significant improvements, stronger belief that treatment works, less agreement with stereotypes, lower overall public stigma, less perceived structural discrimination, less self-devaluation, less fear of stigma, pretty much positive movement across the board.
Okay, so that paints a much clearer positive picture for the national
Yeah.
impact. But you mentioned there was still a concerning finding nationally about knowledge.
Yes, this was quite stark. They found that people in the national sample who actually had substance use problems, especially opioid use problems, they had significantly lower knowledge about naloxone, where to get it, how to use it, and also lower knowledge about how to find treatment compared to people without substance use problems.
Wow. So the people who arguably need that information the most are the least likely to have it.
Exactly. It highlights a really critical gap in getting information and resources to the right people.
That definitely underscores why targeted efforts are so important. Anything else notable from the national study?
One other interesting thing. Among the people with substance use problems who watched the stories nationally,
Yeah.
there was a significant change in how they viewed character. Afterwards, they disagreed more strongly that their problems were because of their own poor character.
Oh, that's really powerful. So the stories might actually help challenge that internalized stigma, promote some self-compassion.
Seems like it. It's a very encouraging sign.
Okay, so putting it all together, it sounds like this Stories Ending Stigma campaign overall really showed a lot of promise in tackling this incredibly tough issue of addiction stigma, both locally in Florida and, perhaps more consistently, nationally.
That seems fair to say, yes. The campaign definitely had significant success, particularly using those personal stories to build empathy, change some perceptions. The improvements around social distance and MAD attitudes seem especially strong.
Right. And even though those weird findings in Tampa Bay show it's complicated and maybe the messaging needs tweaking,
Exactly.
the overall direction seems positive.
It does. Those Tampa results remind us how nuanced this work is, how important it is to keep checking if the message is landing right. But the national results really back up the core idea that sharing these stories can make a real difference on a larger scale.
It really does highlight the potential, doesn't it, for these kinds of sustained contact-based campaigns to actually shift public attitudes and hopefully lower those huge barriers people face in getting help and finding recovery. So what are the key takeaways for us, for you listening?
I think the main takeaway is that campaigns like this, stories ending stigma, they're worth investing in, refining them, keeping them going. Using personal stories seems like a really powerful way to change how society sees addiction. You just can't underestimate the power of narrative to build understanding, empathy, and fight prejudice.
Well, this has been a really, really insightful deep dive, such an important topic. And it kind of leaves me with a final thought for you, our listener. Maybe take a second to think about your own views, your own assumptions, maybe biases around addiction. How might hearing the actual stories of people in recovery change those views? Could it help create a more supportive, less stigmatizing environment for everyone? I'd really encourage you, actually, check out the Live Tampa Bay website. We'll put a link in the show notes. You can see some of these stories yourself. It's a powerful way to connect with the real people behind this issue.